Fundamentals of Nursing, 3rd edition, Chapter 37, Perioperative Nursing Care. In the realm of perioperative nursing care, we navigate through 3 distinct phases that encompass the surgical journey of a patient. The perioperative period, a term that encapsulates the entire surgical process, is our guiding framework. The first phase, the preoperative phase, is akin to the preparation of a stage before a performance. Here, our patient is meticulously prepared for the impending surgery, ensuring all necessary precautions and preparations are in place. Next, we transition into the intraoperative phase, the main act of our surgical performance. During this phase, the patient is anesthetized, monitored, prepped, positioned, and draped. It is here that the surgical procedure is performed, with the patient under our vigilant care. Finally, we enter the postoperative phase, the denouement of our surgical narrative. This phase is characterized by handoff communication, a critical exchange of information to ensure continuity of care. We assess the patient's response to the procedure, vigilantly prevent complications, and actively promote healing, guiding our patient towards recovery. Next, slide number 4. In the theatre of surgery, patient positioning plays a pivotal role. It's akin to setting the stage for the surgical performance, each position tailored to the specific act, or in our case, the surgical procedure. The supine position sees the patient lying flat on their back, a common position that serves as a canvas for a variety of procedures. The lithotomy position, on the other hand, involves the patient lying on their back with their legs raised and separated, a position often employed for procedures involving the lower abdomen and pelvic region. The jackknife position is quite unique, with the patient lying prone, their hips flexed at a 90-degree angle, and their head and legs lowered. This position is typically used for procedures involving the lower back and rectal area. The lateral position involves the patient lying on their side, a position often employed for procedures involving the kidneys or thoracic region. The high Fowler's position sees the patient sitting upright at a 90-degree angle, a position often used for procedures involving the upper body, such as thyroidectomies. The Trendelenburg position involves the patient lying supine, but with their head lower than their feet, a position often used for pelvic and lower abdominal surgeries. Finally, we have the prone position, where the patient lies on their abdomen, a position typically employed for spinal or posterior cranial surgeries. Each position is a tool in our repertoire, allowing us to provide the best care for our patients during their surgical journey. Surgery, in its myriad forms, can be classified in several ways, each providing a unique perspective on its purpose, urgency, and risk. Slide 5. Surgery, in its myriad forms, can be classified in several ways, each providing a unique perspective on its purpose, urgency, and risk. Firstly, we classify surgery by its purpose, much like categorizing a story by its genre. Diagnostic surgeries are investigative, seeking to confirm or rule out a diagnosis. Ablative surgeries remove diseased tissue, much like pruning a diseased branch from a tree. Constructive surgeries aim to restore function that was absent at birth due to congenital defects, while reconstructive or restorative surgeries aim to restore function or appearance lost due to trauma, disease, or aging. Transplantation surgeries replace malfunctioning organs or tissues. Palliative surgeries aim to relieve symptoms and improve quality of life, and cosmetic surgeries enhance appearance for personal satisfaction. Secondly, we consider the degree of urgency, akin to the pacing of a narrative. Elective surgeries are planned in advance, allowing for preparation. Urgent surgeries are required within a short time frame to prevent further complications, and emergency surgeries are immediate, life-saving interventions. Lastly, we classify surgeries by their degree of risk. Minor surgeries carry less risk and typically involve superficial tissues, while major surgeries involve deeper tissues or vital organs and carry a higher degree of risk. Just as each story is unique, so too is each surgical procedure, each with its own purpose, urgency, and risk. Slide 6. The degree of risk associated with a surgical procedure is not a static concept. It's influenced by a constellation of factors, each contributing to the overall risk profile. The general health of a patient is a fundamental factor. A robust state of health can act as a buffer, while chronic conditions may increase the risk. Medications, too, play a significant role. They can interact with anesthesia, affect blood clotting, or influence vital signs, necessitating a thorough review of the patient's medication regimen. The mental and cognitive status of a patient is another crucial consideration. Anxiety, depression, confusion, or cognitive impairment can affect a patient's ability to cope with surgery and adhere to post-operative instructions. Nutrition is the fuel that powers our bodies. Malnutrition can impair wound healing and immune function, while obesity can increase the risk of complications. Cardiac disorders can heighten the risk of cardiac complications during surgery, necessitating careful preoperative assessment and intraoperative monitoring. Blood coagulation disorders can increase the risk of bleeding or clotting complications, requiring appropriate preoperative testing and perioperative management. Lastly, respiratory disorders can increase the risk of respiratory complications, underscoring the importance of preoperative pulmonary function assessment and postoperative respiratory care. Each of these factors interweaves to form the tapestry of surgical risk, necessitating a comprehensive, holistic approach to perioperative care. Slide 7. Continuing our exploration of factors that influence surgical risk, we delve into additional considerations that contribute to the complexity of perioperative care. Renal disorders, for instance, can affect fluid and electrolyte balance, potentially complicating anesthesia management and postoperative recovery. Similarly, liver disease can impact drug metabolism and blood clotting, necessitating careful perioperative planning. Diabetes mellitus, a common chronic condition, can affect wound healing and increase the risk of infection, underscoring the importance of meticulous blood glucose control in the perioperative period. The use of illicit drugs and nicotine can introduce additional risks, affecting cardiovascular and respiratory function, and potentially interacting with anesthetic agents. A thorough substance use history is therefore essential. Family history can provide clues to genetic predispositions, such as the rare but serious condition of malignant hypothermia, a potentially fatal reaction to certain anesthetic agents. Lastly, a history of previous surgery can influence surgical risk. Scar tissue, adhesions, or altered anatomy can complicate the procedure, while previous exposure to anesthetic agents or antibiotics can lead to the development of resistance or allergies. Slide 8. The setting in which a surgical procedure takes place is another key aspect of perioperative care. Each setting is tailored to accommodate different types of surgeries, patient needs, and healthcare delivery models. Hospitals, for instance, are equipped to handle a wide range of surgeries, from minor procedures to complex operations. They provide comprehensive preoperative, intraoperative, and postoperative care, making them suitable for surgeries that require extensive care or prolonged recovery. Ambulatory care centers, on the other hand, specialize in outpatient surgeries. These facilities allow patients to undergo surgery and recover under the care of medical professionals, all within the span of a single day, without the need for an overnight stay. Same-day surgery centers, similar to ambulatory care centers, facilitate surgeries that can be completed within a day. However, they are often affiliated with hospitals, providing a seamless transition if an overnight stay becomes necessary. Outpatient centers, often located within hospitals or clinics, are designed for minor surgical procedures. These procedures typically do not require anesthesia or a prolonged recovery period, allowing patients to return home the same day. Slide 9. Patient safety is paramount during surgery, and as perioperative nurses, you play a critical role in ensuring this. One of the key resources guiding your practice should be the AORN Perioperative Standards and Recommended Practices. These guidelines provide evidence-based recommendations for safe and effective perioperative care, covering a wide range of topics from infection prevention to surgical site marking, from medication safety to documentation. Participation in patient safety programs is another crucial aspect of your role. These programs aim to foster a culture of safety within the healthcare setting, promoting practices that minimize the risk of harm to patients. As a nurse, you are not only a participant but also an advocate for these programs, holding your peers accountable for adhering to all safety standards. Creating a patient safety culture is not a solitary endeavor. It requires good teamwork, effective communication, and a sense of shared accountability. When these elements come together, they enhance the quality of patient care, leading to improved patient outcomes and satisfaction. Remember, in the realm of perioperative nursing, your commitment to patient safety can make a significant difference. It can turn a potentially stressful and risky experience into a safer, more positive journey for the patient. Slide 10. The journey through the phases of surgery is marked by changes in both the physical structure and functional capacity of the patient, each phase presenting its unique challenges. In the preoperative phase, emotional responses such as stress, anxiety, and fear are common. These psychological states can have physiological repercussions, potentially affecting the patient's heart rate, blood pressure, and overall readiness for surgery. As nurses, providing reassurance, education, and empathetic care can help mitigate these responses. The intraoperative phase introduces a different set of alterations, largely due to the use of anesthesia. Anesthesia, whether it's sedation, general, or regional, temporarily alters the patient's consciousness, sensation, and autonomic function to facilitate the surgical procedure. Each type of anesthesia carries its own risks and benefits, and the choice depends on the nature of the surgery, the patient's health status, and their preferences. The postoperative phase is characterized by alterations resulting from the surgical procedure itself. These can range from physical changes at the surgical site to systemic responses such as pain, inflammation, and changes in mobility. Effective postoperative care involves managing these alterations, promoting healing, and facilitating the patient's return to their preoperative state. Slide 11. The preoperative phase is a critical time for gathering information, setting the stage for the surgical journey ahead. A comprehensive health history and physical assessment serve multiple purposes. Firstly, it acts as a screening process, identifying any potential risks or contraindications to surgery. This could include underlying medical conditions, allergies, or previous adverse reactions to anesthesia. Secondly, it establishes baseline data, providing a reference point against which postoperative changes can be compared. This could involve documenting vital signs, physical findings, and the patient's self-reported level of comfort or function. At this stage, discharge planning also begins. This might seem early, but considering the patient's postoperative needs from the outset can help ensure a smooth transition from hospital to home when the time comes. While the surgeon and anesthesia team perform their own evaluations, the nurse plays a pivotal role in preparing the patient for surgery. This includes reviewing preoperative testing results, verifying that informed consent has been obtained, and addressing any questions or concerns the patient might have. Slide 12. The preoperative health history and physical assessment extend beyond the initial screening and baseline data collection. It delves deeper into the patient's current state, focusing on their activity level and level of consciousness, vital signs, and the results of any laboratory and diagnostic examinations. The patient's activity level and level of consciousness provide valuable insights into their neurological function, This involves assessing their orientation, ability to maintain thought patterns, follow commands, and respond to questions and tactile stimulation. Any changes or abnormalities in these areas could indicate a potential neurological issue that may need to be addressed before surgery. Vital signs, including blood pressure, pulse, respiratory rate, temperature, and pain level, offer a snapshot of the patient's physiological status. These parameters can help identify any immediate concerns that might impact the patient's surgical risk or anesthesia management. Laboratory and diagnostic examinations provide a more detailed view of the patient's health. The specific tests performed will depend on the patient's medical problem, pre-existing illness, overall health status, age, and the nature of the surgical procedure. These could include blood tests, imaging studies, or specialized tests like electrocardiograms or pulmonary function tests. Slide 13. During the intraoperative phase, the patient is in the operating room and the surgical procedure is performed. This phase requires meticulous attention to detail and continuous monitoring to ensure patient safety and the successful completion of the surgery. One of the primary responsibilities during this phase is the continuous monitoring of vital signs. This includes tracking the patient's heart rate, blood pressure, respiratory rate, oxygen saturation, and temperature. Any significant changes in these parameters could indicate a potential issue that needs immediate attention. In addition to vital signs, the assessment of positioning and other safety concerns is paramount. Proper patient positioning is crucial to prevent injury, ensure optimal surgical access, and maintain the patient's comfort. Safety concerns may also include maintaining a sterile environment, ensuring proper functioning of equipment, and monitoring for any signs of adverse reactions or complications. Two key roles in the intraoperative phase are those of the circulating nurse and the scrub nurse. The circulating nurse is a perioperative nurse who works outside the sterile field. They coordinate, oversee, and are involved in the patient's nursing care in the operating room. This includes preparing the room before surgery, assisting with anesthesia induction, and ensuring the patient's safety throughout the procedure. The scrub nurse, on the other hand, works within the sterile field. They assist the surgeon by passing instruments, holding retractors, and performing other tasks as needed during the procedure. The scrub nurse must adhere to strict aseptic principles to prevent surgical site infections. Slide 14. During the postoperative phase, the patient is transferred to the post-anesthesia K unit POCU, where they are closely monitored as they recover from anesthesia. The POCU nurse plays a pivotal role in this phase, beginning with receiving a comprehensive post-surgery report on the patient. This report includes details about the surgical procedure, any complications encountered, the patient's response to anesthesia, and other pertinent information. The POCU nurse then takes over the monitoring of the patient's condition. This involves performing regular patient assessments, which include several key components. Vital signs, such as blood pressure, pulse, respiratory rate, temperature, and pain level, are closely tracked to detect any deviations that might indicate a problem. The nurse also monitors the patient's surgical dressings, drains, and tubes. This includes checking for any signs of bleeding, infection, or other complications, as well as ensuring that drains and tubes are functioning properly. A neurologic assessment is another crucial part of the POCU nurse's responsibilities. This involves evaluating the patient's level of consciousness, orientation, and responsiveness, as well as their motor and sensory function. Any changes in these areas could signal a potential neurological issue that needs immediate attention. Finally, the POCU nurse monitors the patient's elimination status. This includes assessing the patient's urinary and bowel function, as anesthesia and surgery can often impact these systems. In essence, the post-operative phase is a critical period where vigilant monitoring and prompt intervention can significantly impact the patient's recovery and surgical outcome. As a perioperative nurse, your role in this phase is vital in ensuring the patient's safety and well-being. Slide 15. During the preoperative phase, patients often experience a range of emotions and uncertainties about their upcoming surgery. Two common nursing diagnoses during this phase are anxiety and lack of knowledge. Anxiety is a common response to the anticipation of surgery. It is often characterized by a change in health status, fear of the unknown, and physiological responses such as increased blood pressure, heart rate, and respiratory rate. Patients may also express their nervousness verbally. As a nurse, it's crucial to recognize these signs and provide appropriate interventions, such as offering reassurance, explaining procedures in understandable terms, and encouraging questions to alleviate fears. Lack of knowledge is another common nursing diagnosis in the preoperative phase. This is often evident when patients are unfamiliar with preoperative procedures, frequently ask questions, or demonstrate a repeated need for explanations. This lack of understanding can contribute to anxiety and fear. As a nurse, your role is to provide clear, concise, and accurate information about what the patient can expect before, during, and after surgery. This includes explaining the purpose and process of the surgery, discussing potential risks and complications, and outlining the recovery process. Providing this information can empower patients, reduce anxiety, and enhance their overall surgical experience. Slide 16. During the intraoperative phase, the patient is under anesthesia and the surgical procedure is being performed. Two common nursing diagnoses during this phase are impaired breathing and risk for perioperative positioning injury. Impaired breathing can occur due to the effects of anesthesia and narcotic medications, which can depress the respiratory system. This can lead to shallow breathing, tachypnea, and abnormal blood gas results. As a nurse, you'll need to continuously monitor the patient's respiratory status, ensuring adequate oxygenation and ventilation. This may involve adjusting the anesthesia as needed, encouraging deep breathing exercises when the patient is awake, and providing supplemental oxygen if necessary. Risk for perioperative positioning injury is another potential concern during the intraoperative phase. This can occur if the patient is improperly positioned during the surgical procedure, leading to nerve damage, pressure ulcers, or musculoskeletal injuries. As a nurse, it's your responsibility to ensure the patient is correctly positioned and supported to minimize these risks. This involves using appropriate padding and supports, regularly checking the patient's alignment and pressure points, and adjusting the position as needed to prevent injury. Slide 17. In the postoperative phase, the patient is recovering from surgery. Two common nursing diagnoses during this phase are acute pain and risk for infection. Acute pain is a common postoperative complication due to tissue injury at the surgical site. This can manifest as verbal reports of pain, rubbing and godding the surgical site, increase in blood pressure, heart rate, and respiratory rate, and loss of the ability to sleep, ambulate, and perform activities of daily living ADLs. As a nurse, your role is to assess the patient's pain level regularly, administer prescribed pain medications, and implement non-pharmacological pain relief strategies such as relaxation techniques, distraction, and cold or heat therapy. Risk for infection is another potential concern in the postoperative phase due to the invasive nature of the surgical procedure. As a nurse, you'll need to monitor the surgical site for signs of infection, such as redness, swelling, warmth, pain, or purulent discharge. You'll also need to educate the patient on proper wound care, encourage good nutrition for wound healing, and administer prophylactic antibiotics if prescribed. Slide 18. In terms of planning, Some examples of goals for the patient during the different phases of surgery could include preoperative. The patient will exhibit vital signs within normal limits in the preoperative period. The patient will verbalize understanding of the surgical procedure before the operation. Intraoperative. The patient's airway will remain patent during surgery. The patient will be positioned appropriately during surgery. Postoperative. The patient will report a pain level of 3 or less in the postoperative period. The patient will remain free from infection in the postoperative period. Slide 19. During the preoperative phase, one of the key roles of a nurse is to provide preoperative teaching. This education helps decrease fear, anxiety, and stress, and can also reduce postoperative complications. The teaching should be tailored to the individual patient, taking into account their level of understanding, health literacy, and learning preferences. It should cover topics such as the nature and purpose of the surgery, the surgical process, the roles of the surgical team, the expected outcomes, the potential risks and complications, and the postoperative care and recovery process. Another crucial aspect of preoperative care is developing a pain management plan. This plan should be explained to the patient and should incorporate effective pain management strategies and therapies that the patient has used in the past. The plan should also consider the patient's cultural beliefs and expectations about pain and its management. For example, some cultures may view pain as a natural part of healing, while others may expect complete relief from pain after surgery. The plan may include pharmacological interventions such as analgesics and anesthetics, as well as non-pharmacological interventions such as relaxation techniques, distraction, guided imagery, and complementary and alternative therapies such as acupuncture, massage, or aromatherapy. The goal of the pain management plan is to ensure that the patient's pain is adequately controlled, to enhance their comfort and satisfaction, and to facilitate their recovery and rehabilitation. Slide 20. In the preoperative phase, obtaining informed consent is a critical step. This process involves providing the patient with sufficient information to make an informed decision about the surgery. The information should include the nature and purpose of the surgery, the expected benefits and outcomes, the potential risks and complications, the alternatives to the surgery, and the consequences of not having the surgery. The physician is responsible for obtaining informed consent, but the nurse can play a supportive role in ensuring that the patient understands the information and has the opportunity to ask questions. Once the patient has given their consent, they sign a document that gives legal authorization for the procedure. It's important to note that informed consent is not just a one-time event, but a continuous process that should be revisited whenever there are changes in the patient's condition or treatment plan. In terms of patient preparation, fasting is usually required before surgery to reduce the risk of aspiration during anesthesia. The duration of fasting depends on the type of surgery and anesthesia, the patient's health status, and the surgeon's and anesthesiologist's preferences. The nurse should explain the reason for fasting and provide clear instructions about when to stop fasting and what foods and fluids are allowed or prohibited. The preoperative checklist is a tool that helps ensure that all necessary tasks have been completed before the patient is taken to the operating room. The checklist may include items such as confirming the patient's identity, verifying the surgical site and procedure, checking the informed consent, reviewing the preoperative assessment and tests, administering the preoperative medications, removing jewelry and dentures, applying anti-embolic stockings or sequential compression devices, and documenting the patient's baseline vital signs. The nurse should go through the checklist with the patient and their family, answer any questions they may have, and address any concerns or issues that arise. Slide 21. During the intraoperative phase, there are several key nursing roles that contribute to the successful execution of the surgery. The scrub nurse or assistant works directly in the sterile field, assisting the surgeon by passing instruments, sutures, and other items. The circulating nurse manages the operating room environment outside the sterile field, coordinating the care and ensuring the safety of the patient. The certified registered nurse anesthetist CRNA administers anesthesia and monitors the patient's responses to anesthesia during surgery. The registered nurse first assistant RNFA assists the surgeon during the procedure, performing tasks such as tissue handling, suturing, and hemostasis. The type of anesthesia used is determined by the anesthesia provider, the type of surgery, and the patient's health. The patient's responses to anesthesia are continuously monitored during surgery to ensure safety and comfort. Slide 22. In the postoperative phase, nursing care focuses on airway management, monitoring vital signs, monitoring neurologic status, pain management, and ensuring postoperative safety. These tasks are crucial in detecting and managing potential complications early. Slide 23. Nurses also play a vital role in managing common postoperative complications. These may include airway obstruction, hemorrhage shock, thrombophlebitis, pulmonary embolism, pneumonia, atelectasis, and wound complications. Each of these complications requires specific nursing interventions and management strategies to ensure the patient's recovery and well-being. Slide 24. In addition to the complications mentioned earlier, there are also complications associated with spinal or epidural anesthesia. These can include headaches, hypotension, or in rare cases, nerve damage. Nurses monitor for these complications and manage symptoms as needed, often in collaboration with the anesthesia team. Slide 25. Postoperative care also involves careful attention to the surgical site. Nurses monitor for signs of infection, ensure the wound is clean, and change dressings as prescribed. They also provide patient education and wound care for after discharge, after the patient leaves the post-anesthesia care unit. Further postoperative care continues. The Aldrich score, a tool used to assess a patient's readiness for discharge from the recovery room, is used. Early ambulation is encouraged to promote circulation and prevent complications like deep vein thrombosis. Fluids and hydration are managed to ensure the patient is well hydrated, and diet is gradually advanced as tolerated. When it's time for discharge, nurses provide thorough education and home care, including medication management, activity restrictions, and signs of complications to watch for. Follow-up appointments are also arranged. Slide 26. Throughout the perioperative period, evaluation is ongoing. Nurses continually assess whether expected outcomes are being met. If outcomes are not met, the plan of care is reevaluated and adjusted as necessary. If outcomes are met, the nurse determines whether it's appropriate to continue the current interventions. Documentation is a crucial part of this process, providing a detailed record of the patient's perioperative journey